The main complications you've probably heard, I mean, you've been told over and over as you get ready for surgery and when you're in the hospital, trying to avoid blood clots. That's the biggest concern and complication, and obviously infection. But besides that, there's some things that we in physical therapy we run into down the road that we can prevent a lot of those complications just in these first probably 3 to 6 days. So I want to take you through some instructions that they've been telling you, but maybe you don't grasp the ramifications down the road. So there's something they're talking about where they're wanting your legs straight a lot. I want to talk about that just so that you understand the importance of that. The number one complication, besides the big ones that we already talked about in rehab, is not regaining full extension of your knee. And when I say full, and we're talking about all the way straight, just like your other knee. And mainly it's because of walking. So in a normal gait cycle, you have there's a portion of your gait cycle where your knee is straight and your thigh muscles contract just momentarily. So when that does not happen, imagine walking like a frog walk, or imagine walking in a squatted position all the time and the stresses that are happening on your knee, especially your kneecap. So people that don't regain full extension, often later after rehab, and sometimes it's 3 to 6 months later, will develop pretty significant kneecap pain and inflammation. Is basically like a tendonitis of the tendons around the knee or the kneecap due to overstress, because it's not designed to do that. So back to the point. It was interesting because in the hospital, everybody kind of they're all trying to get you to have your legs straight, and they have different explanations on how to do it and why. But and I just noticed that they never tell you the ramifications and how important it is to do that, and what might happen if you don't do that. Truth is, this is not comfortable. Gets very achy and very painful. So I think there's conflicting information coming from the nurses, the doctor, even the physical therapist sometimes on this propping up of your heel and your ankle. You can't stay like this all the time, because what happens when you get when you have pain in your knee and you're not paying attention, you're watching TV or trying to distract yourself, when there's pain there, your body is going to naturally find a position where it's not painful. So what happens, you're just going to contract your leg a little. I'm exaggerating a little bit, but you're going to contract that leg and take pressure off of it, even though you think you're propping your heel up. So I do recommend that you get comfortable and you get a little bend in your knee for the majority of the time when you're down propping that leg up. But I would definitely recommend like once an hour that you really get that big gap underneath the knee. I'm going to show you here. So there should be space underneath there so that you can relax and get full extension on that. You can push it down, but I do recommend once you get it pushed down and kind of there, I want you to relax as much as you possibly can. And then you really need to hold this quite a while. So I usually recommend 3 to 5 minutes. And it should get pretty achy, not extremely achy, but you should feel pressure and you'll build up some ache in there. It's really kind of achy coming off of that. But if you bend it a little bit and then just pump that knee, kind of gets the juices flowing back in there so that it's kind of happy again. And then basically I go back down, push a little bit, and then relax, and then don't think about it too much. Try to relax, and gravity's going to take care of that. It's going to slowly take you down to where it wants to be. Again, simple. These seem simple, but the ramifications of not getting your knee straight again are really hard to address. Even 3 weeks into your rehab, 6 weeks into your rehab, if you don't have knee extension, then it gets really complicated and it delays everything and can create all kinds of problems down the road.